Good evening. Greetings from Indian Rheumatology Association. And I'm very glad that you are observing this month as Scleroderma Awareness Month. And it's an extremely important need to improve the awareness about this very rare disease. And today I understand that you are having a program which is attended by many patients with Scleroderma in understanding that disease, because until you have had this disease and a doctor made a diagnosis, which might have taken long time, because most doctors would not have seen a single patient of Scleroderma in their training and their lifetime. And you would not have heard about this term as Scleroderma or progressive systemic sclerosis. And none of your family members and friends would have heard about this term. So it is extremely difficult for a normal person to become a patient with an unknown, strange name, and nobody knows what it is, including many doctors. And you have endured that, and now we are all formed a supportive group to support each other in your journey through with this disease. And IRA is happy to support you in many ways. As you all know, Scleroderma is an autoimmune disease, but it is a very unique autoimmune disease. Contrary to other commonly seen autoimmune diseases like lupus, here there are 2-3 different components play a huge role. One is fibrosis, so that's the reason the sclerosis part, tightness part comes, and vascular, and people do get Raynaud's phenomena, sensitiveness of the blood vessel to temperature and emotions, which can lead to sometimes digital ischemia and loss of digital function. And the third major component is autoimmune process and autoantibodies. So somewhere all these three processes join together to produce a very unique and complex disease, which can be very difficult to manage for the doctors, even diagnose for the doctors, and much worse, it can be much difficult to live with for many people who have been affected by this disease because of its significant physical changes and Raynaud's and loss of digital function and involvement of the internal organs. Sometimes which can be life-threatening, and quality of life can be significantly reduced. As I have alluded to earlier, Scleroderma is a rare disease, and so rare that many of the doctors would not have even seen a single patient in their lifetime. And Indian government has got something called rare patients, a rare illness registry. And if the government accepts a disease as a rare disease, they support the entire treatment program for the patients. One example is immunodeficiency syndrome. The patients with immunodeficiency syndrome are routinely given immunoglobulins, which are very expensive therapy by the government in government facilities. And I'm sure Scleroderma being a rare disease might satisfy the criteria of rare diseases. And I think you all should explore this idea. We, as Rheumatology Association, we would try to give you all the support. If a letter is required from IRA, we are happy to give you. And we'll also do some basic research to give you the data about its prevalence, etc. I think this is one attempt we should do together. And IRA, as a association of doctors who are experts in the management of Scleroderma, would like to educate our own doctors, rheumatologists. So we conduct national meetings, Indian Rheumatology Association conferences, multiple regional and midterm conferences to educate our own doctors about the recent advances happening in this field, because many times advances happen at such a rapid pace, even a specialist would find it difficult to catch up with all the advancements. Apart from rheumatologists, we also have CMEs for non-rheumatologists, like a general rheumatologist CME, but we will also have few topics on scleroderma and related disorders. So we try to educate the doctors, general physicians, orthopedic surgeons, and physicians, general practitioners, etc. Even pulmonologists, sometimes as dermatologists. So we need to educate this, but we try to address this issue periodically. Since last 10 years, we have been having multiple inter-society. We have common meetings with dermatology society so that whichever specialty patient chooses to go, the standard of care should be uniform. And we also, IRA as a body, have public education and patient education programs. We encourage our clinicians to have regular education programs for both for public and patients. And we can, along not only to Scleroderma Society, for most of the patient support groups, IRA promises to be the knowledge partner. We can, whenever you call, one of us would be ready to come and talk to the patient groups and educate the patient groups regarding the illness, the need for medications, allay their fear about the toxicity of medications, and update them what if there is any new treatment, breakthrough treatment comes through. So this is our endeavor and our effort. And we would also happy to partner with all the support groups, including Scleroderma India, in their advocacy for getting insurance cover. We have been trying. So far, we have not been successful. I'm still trying to get an appointment with the health minister. And you know how government works. Unless you have a contact, sometimes it's difficult to even reach them. So we have not stopped trying. And me and our president-elect Chandrasekhar is also from Bangalore. And both of us have the same agenda and zeal. And I'm sure during my period or his period, something significant should happen to people with autoimmune disease with regards to insurance and other aspects. And these are the few activities which IRA generally does towards improving the knowledge for both for patients, doctors, and the clinicians who deal with this disease. I think with these few words, I would happy to inaugurate this education program. I'm sure you have many wonderful clinicians and rheumatologists and patient experts. We would call them patient experts because having lived with this disease for many years, and many times you guys know much more than us regarding your illness, and we would be happy to hear from you. And most of the knowledge transfer occurs from both the sides. We have learned a lot from many patients, not only scleroderma patients, many patients. Some of the simple tricks they do to improve themselves, so impressive that we imbibe them and pass it on to other patients. And I'm sure this meeting is going to go a long way in improving the knowledge and the confidence of you all to deal with a difficult disease. I'm also, you are all aware, and I am aware of the loss of your founder president. And it's quite sad that she's not there with us today. And wishing you all a great year ahead and great learning during this meeting. Thank you very much.